Hi, my name is Jeff Scaling, President of Sole Provider Custom Orthotics and Medical Supplies in Kentville. Since 1995, my wife Julie and I have been serving clients in the Annapolis Valley and Western Nova Scotia with Orthotic services. A podorthist is an individual who's trained in the manufacture, fitting, and modification of foot appliances and footwear for the purposes of alleviating painful or debilitating conditions and providing assistance for abnormalities or limited actions of the lower limb, specifically the feet. The podorthist can provide devices and footwear that assist in accommodation of foot deformities, realignment of anatomical structures, redistribution of external and internal forces, improvement of balance, control of biomechanical function, accommodation of circulatory special requirements, and also enhancement of the actions of the lower limb, which could be compromised as a result of accidents, congenital deformities, or disease conditions. Assessments for custom-made foot orthotics take place here at our clinic at 70 Exhibition Street, Kentville, in the Valley Professional Center. We also hold a weekly clinic at the Digby General Hospital in Digby. Assessments take approximately 1 hour, and during that time, our certified podorthic staff will perform a gait analysis, a detailed biomechanical evaluation of your lower extremities, and a detailed history taking. We do require a doctor's written referral or prescription to actually fabricate a custom-made device. And fabrication of the orthotics takes place on site here as well. We have a full-service lab at the same location as our main clinic in Kentville. The assessment itself, when complete, will allow us to fabricate a custom-made device that will correct certain biomechanical problems you may have and to assist you in alleviating any painful conditions of your foot or lower extremity. It takes approximately 2 weeks to fabricate a pair of custom-made foot orthotics, at which time we have our clients back to our office to do a fitting. We always like to see the clients for the fitting to ensure that the device fits the foot properly and to pass along the wearing instructions. It takes a little time to get used to custom foot orthotics, so we really like to reinforce the fact that a gradual break-in is very important. 2 weeks post-pickup, we generally book our clients with a follow-up appointment. This also allows us to ensure that the custom foot orthotics are providing the amount of correction that we wish them to do and also alleviating the painful symptoms the patient had when they came to our office originally. To fabricate custom foot orthotics, we require a three-dimensional cast or mold of the patient's foot. At Sole Provider, we do this with two main methods. The primary method is with a semi-weight-bearing foam cast impression, in which the patient is either sitting or standing, and the certified podorthist will place or imprint the patient's foot into a foam casting material. The second method that we use is a plaster slipper casting method. This is a non-weight-bearing casting method, which is also effective in capturing a three-dimensional image of the patient's foot. Plaster of Paris cloth is soaked and applied to the patient's foot while they're lying, usually on their stomach, on their tummy. With some clients, if they're unable to lie on their stomach, we can actually cast them in a standing kneeling position with their knee on a chair and their foot suspended. This non-weight-bearing method is less commonly used at our office, but still very effective at taking a three-dimensional cast of the patient's foot. Once we've captured a three-dimensional image of a patient's foot, the certified podorthist will fill out a work order which indicates to the lab what corrections they wish to have in the device, the type of device, the materials for the shell of the device and the top covers, and that cast and work order then go downstairs to our lab facility. At that point, the cast is actually scanned with a three-dimensional laser scanner into our computer system. The computer system we have uses software which allows us to modify that casted image on the computer screen to correct as the podorthist wishes. Once the image has been corrected, a positive mold of the patient's foot is milled from MDF, medium density fiberboard effectively, and that positive corrected mold is what we use to build the orthotic device on. Most of our materials are thermal moldable or heat moldable materials, and we're able to heat mold these materials and vacuum form them over the corrected model of the patient's foot. Once the shell portion of the device has been made, we are able to modify it again according to the podorthist's work order and finish the device with top covers, and then it's prepared for the patient for pickup. Besides custom-made foot orthotics, Sole Provider also carries a full line of orthopedic, therapeutic, and comfort footwear. If our patient's footwear won't provide the best match to give the best amount of correction with the orthotics we're making, we have the option of fitting them with in-stock footwear. When custom foot orthotics and orthopedic footwear aren't quite enough, Sole Provider staff can also evaluate and cast for a full pair of custom-made shoes. Custom-made shoes are generally reserved for patients who won't get enough benefit from orthotics or orthopedic footwear alone, and they're usually the result of congenital deformities or injury or trauma to the foot that prevents patients from fitting into regular orthopedic footwear. Sole Provider also carries a full range of orthopedic bracing products, both custom-made and off the shelf. Our staff are trained in the fitting and assessment for these products. We also carry a full line of compression garments. We have numerous staff that are trained in the fitting of lower extremity and upper extremity compression garments, as well as post-mastectomy supplies. To ensure that we're providing a complete service for our clients as far as their lower extremity is concerned, we also work with a certified chiropodist. The chiropodist is an individual that's trained in the care of corns, calluses, and nail problems with the foot. This treatment protocol, as well as our custom foot orthotics, orthopedic footwear, and other services, really allows us to provide a complete service to our clients. If you have any questions on what we've discussed, or if you'd like to learn more about what Sole Provider can do for you, please feel free to contact us or drop by our office in the Valley Professional Center in Kentville. We'd really like to help you feel better from the ground up.